It's Leslie Guerrero, and I'll be doing a case study regarding the respiratory system. So, a 55-year-old male came into the ER complaining of chest pain and of large amounts of pleuritic coughing. He had SOB, which is shortness of breath, that caused him not to be able to be physically active and have feeling of malaise. His wife as well came in feeling a bit ill, but mostly was concerned about her husband. As we examined him using the sputum test, he showed signs of excessive bloody sputum, also known as hemoptysis. He had a fever that ran up to 103 degrees, causing most of his hyperhidrosis, or his night sweats. He had been experiencing these symptoms for a month, but stated that he had lost 40 pounds over the course of 4 months, also known as cachexia. With the excessive sputum, we do the pulmonary function test to measure the ventilation of the lungs. With a more thorough exam, cavernous breathing sounds were heard over his right side, and a chest x-ray was taken in order to get a clear image of the chest in an anterior, posterior, anterior, and lateral view. In his film, we could see pulmonary infiltrate in the right upper lobe. He was then tested for AFB, acid-fast bacilli, which came back positive. He lives in a household with only his wife, who was given the tuberculin test. If the skin is sensitive to the test, then his wife is infected by tuberculosis. And because she never had treatment, she also developed the active disease, which was spread to her husband. The antimicrobial susceptibility testing was used to understand which antibiotics were going to be most effective for the 55-year-old male. He was treated with 4 main drugs such as INH, rifampin, pyrazinamide, and ethambutol. Patients with this disease usually must stay in isolation for 2 weeks and are needed to take these medications in hopes that 2 out of the 4 medications will not be resisted by the organisms in his body. He was diagnosed with active TB. Thank you.